what's the biggest like seniority moment that somebody's tried to like lean on you during your training years?
Like what? Like what do you mean?
Like a seniority flex is what I'm trying to say, where somebody is
I
trying
know.
to just like
Oh,
pass what's the biggest, like somebody is so above you and they passed on to you the most like either demeaning or trivial or pain in the ass task for you to do? What jumps out at
task?
you?
I mean, I can't remember a task, but yeah, I
Like
mean,
a
I can
decubit
remember.
ulcer debridement or something that you didn't have to do and they made you do
Oh,
it?
Fortunately, I've never
yeah.
had to do that. Yeah,
I had to do. Actually, I mentioned this on a video one time. I had to do.
That's a
when I
pressure
was
sore for people that don't know.
Yeah, when I was an intern, I was working overnight, and I was working with actually my friend. I don't know if she wants to be on this podcast, but
she was my block that one out.
She does now.
Yeah, she was my senior resident at the time.
Okay, one viewer of ours will.
Yeah, no, yeah, I love her. We're friends, but she like the only time someone's ever pulled rank on me is because there's a patient in the ER with impacted stool, and she was like, "Look, she's like, I don't want to do this to you because you're my friend, but like I can't do this."
Really?
I was like, well, I can't do it either. And for those who don't know, it's basically like sometimes the elderly will get so constipated that their stool just essentially like huge stool ball in the rectum, and it just sits there, and it can become infected. And if you don't relieve it,
bowel perf, bowel ischemia, and all this stuff. Yeah.
And what you have to do is manually disimpact it, literally with your finger. And as soon as you disimpact it, you think like, oh, you just pull out that stool ball, but it's literally like opening up the Hoover Dam.
Oh,
like I mean, I'm talking like all over the floor.
It's like gym on a Saturday.
Just a regular day for gym.
Yeah, it's Tuesday
and
Tuesday morning.
Yeah. But then so that was the only time. But then I actually pulled rank because for some reason I had a med student overnight with me, which is like random. And I was like, look,
med student. Oh.
I know. I was like, look, I can't do this, but I'm gonna need you to do this. And she had like she was tiny and she had a really small hand. I was like, you're perfect for the job.
Yeah. You're like, get on up in there.
She's like, I'll do it. She's like, I'll do it.
I don't think I ever had like, the only thing is because radiology isn't a lot of like stuff, especially diagnostic. There's not like a whole lot of things that are like, oh, I'll only push this off on you. Like Al as a senior and like my seniors and stuff, you have to give like rectal contrast for a CT or something.
Yeah.
I'll be like, I mean, if you know how to do it, like I don't need to be there with you to give rectal contrast. Like I trust you to do that. I think that was that. But I think probably the biggest thing I ran into was on like night shifts. We would early on in my training, our night shifts we would split. So it's like you would come in, like you would kind of stagger them a little bit. So the second person would always stay for 12 hours, but then the first person would like they'd be there probably for like 10 hours or so. But it's you kind of, if you finagle and someone can read fast enough, it's like you don't need two people on overnight back in the day at my place. And we were supposed to split them up, so it's like you don't get the last shift doing 12 hours nonstop by yourself. And I got the people that were seniors would basically just leave like at midnight and be like, all right, peace. And I was like,
see, that's no bueno.
Yeah.
Then you get screwed.
Yeah. Because I was literally as a second year starting call, and it's like, I'm getting rinsed in the ED with studies and it's covering 2 hospitals. And they're like, all right, see you later. And then it's like a stroke comes in and I'm like, okay.
One trauma wrecks your whole day.
Oh yeah.
That's what people don't understand. Well, let me explain that for a sec. So he's talking about is,
you're always one case away.
Yeah.
When it always comes.
That's a commonality between human and vet med. There's just one extra case that keeps you there.
It will always come in too. As soon as you think you're free, you're never free.